Welcome to Under the Hood with Dr. Alex and Dr. Rebecca,
where we share pearls of wisdom from our 30 years of combined clinical experience.
Yeah. Hi, Alex.
Hi.
Okay, so today we are going to be talking about a topic which I think is important and kind of funny. You know, generally, especially when we talk about stuff, we try to keep it pretty ungendered because both of us work with trans folks and, so we try to keep it gender neutral, but this one is going to be a little bit more gendered.
Mm-hmm.
So I'm going to introduce this with a little bit of a story, which is that my husband, Lee, who is a educated, smart person who is very in touch with his physical fitness, recently sent me an article from the New York Times, which was titled "Why Men Shouldn't Ignore Their Pelvic Floors." And he said to me, wait, I have a pelvic floor? And this, neither of our husbands listened to our podcast, so I was not offended by this, but this was well into you and I doing this podcast together.
He's met me many times.
Yes. But still somehow missed that he also had a pelvic floor. And so we figured that probably if Lee, with all of the information at his immediate disposal, fingertips, listening to me talk about it, had not connected that he as a man also had a pelvic floor, other listeners out there may have also had this experience.
Yes.
So tell me about this, Alex. Is this something that you hear a lot?
Oh yeah, absolutely. And not just from men, by the way. I have this really funny memory, mostly because of the accent, but my patient's like, so you're telling me that there's muscles down there? I'll believe it when I see it. And that was when I was working in one of the Boston hospitals. And I just remember I couldn't help myself. I just had to laugh because yes, there are muscles down there.
Yes.
And they're inside. So it's hard for me to show them to you. But at the time, biofeedback was really popular and you could kind of see it on the computer screen going up and down on the graph. So then she believed it. When she was squeezing and relaxing, you could see it on the computer. So men do have a pelvic floor. And in the article in the New York Times, it was talking about this guy who was training for a triathlon. And so I think sometimes people also, if they know that the pelvic floor exists, they associate it with aging and weakness and leaking. And so this person in the story in the New York Times was training for the triathlon, biking all around, and that bike seat puts so much compression on the pudendal nerve and on the pelvic floor muscles themselves that the muscles get tighter and tighter and tighter, and you can get something called pudendal neuralgia where the nerve is really irritated. And so he ended up developing erectile dysfunction and other pelvic health issues and tons of pelvic pain. And I do think it comes as a surprise for people that many of our patients that we work with are young, fit men. And that is not what you typically think about when you think of pelvic floor physical therapy, if you think about it at all.
Well, I think that often when people think about pelvic floor physical therapy, they may think about that perinatal period.
Yes, pregnancy,
postpartum. Okay, yeah, that makes sense. You're pushing a baby out of the pelvic floor muscles. You're, pregnancy, if you're, a carrying mother, carrying parent, then it makes sense.
Yeah, absolutely.
So, but it's not, that is certainly an area where it's important to pay attention to your pelvic floor, but not only.
Yeah, absolutely not. And you can think about it when you are an elite athlete, and this goes for people of all gender expressions, you put a tremendous amount of strain and work into your body. And there's a lot of increased intra-abdominal pressure with high impact exercise, especially. And so your pelvic floor is down there just trying to bear that load and bear that burden. And think about heavy weightlifters, And so it's actually a huge disservice that we don't educate these athletes more about their pelvic health, because if they had better coordination of their pelvic floor muscles, they would probably perform better.
Yeah.
Yeah. We have seen that time and time again in our clinic.
Okay. So you have this category of folks, that this New York Times article was about, and that you see bikers, heavy weightlifters, also folks who are doing, who are young,
tremendous athletes.
Yeah. Tremendous athletes. I have to imagine too that one of the things, I am guilty of this as well, where I work out, but I don't always take the time to stretch appropriately afterwards. And then I find that when I go, if I do that and I have a hard workout and then I sit for my job, then my body feels,
Wonky.
wonky. Now, does that change my practice? Not as much as it probably should. But what about this? What about people who are, maybe working out? Maybe they're not working out, but they're sitting a lot. That also puts a lot of pressure on your pelvic floor, right?
I'm glad that you brought that up because human beings were not designed to be sedentary like we are. It shortens our hip flexors. It really puts us in this posture that we aren't designed to be in. And it puts a tremendous amount of downward pressure there as well. And our pelvic floor is atrophy just like the rest of our muscles. So certainly we are human beings. We're meant to move. We were designed to move. And it's so unfortunate when someone gets an injury and they become afraid to move because that makes everything so much worse.
Yeah.
And we talk a lot about fascia and myofascial release. And there's this really great anatomist, Gil, who does this fuzz YouTube video that's fantastic if people want to look it up. And he talks about how every night when we go to sleep, the fuzz kind of grows in between our fascia and our muscles. Fascia being the connective tissue that's like the saran wrap that wraps around all our muscles and our body. And then when we get up in the morning, if we don't work it out and move in all different planes, not just forward and back, then it gets thicker and thicker and thicker. And then suddenly we realize we actually can't move that way anymore. And we associate that with the aging process. And so the pelvic floor plays a huge role in that, So here we are going about stretching and we're not really thinking about in here. And so in pelvic floor physical therapy, we give people very specific pelvic floor related stretches to help with that process as well.
Okay, so now that a man who might be listening to this would know that they have a pelvic floor, for all those men out there.
Yes, exactly.
Everybody, if you have a pelvis, you have a pelvic floor.
Definitely.
I've heard Alex say this a number of times.
Yes.
Regardless of gender expression. But somebody with a penis who now knows, okay, whoa, I have a pelvic floor. Whoa. What might they notice that could be related to pelvic floor? Can we call it dysfunction?
Sure. And I think it's so brave when guys are willing to admit these very vulnerable and intimate issues. And I had a discovery call this past week with somebody who was basically saying, I'm really embarrassed to tell you about this stuff, but I also am really motivated to make it better.
Yeah.
And I love that so much because the motivation to make it better kind of usurped or came over the embarrassment of discussing it. And I said, well, I've been talking about it every day for 16 years. So let me just put you at ease to say that I'm good, And
I have to wonder when you say that, I wonder how, and maybe you don't know because this is just a discovery call, but I have to wonder when we get to that tipping point where the motivation to make it better is more powerful than the shame of talking about it. People have been in pain for a long time, whether it's actual physical pain or whether
erectile dysfunction, premature ejaculation, all of it.
Yeah, so they might have been dealing with this already for quite some
tried
time.
Medication, told the doctor.
Yeah.
Through their own research, discovered that pelvic floor physical therapy was a thing.
Yeah.
And
that they had a pelvic floor.
That they had a pelvic floor. Yeah.
And then that there's a therapist who specializes in this, a PT.
So to get back to your question, a lot of the issues are pretty private and personal. So it would be not finishing emptying your bladder all the way. So incomplete emptying of the bladder, feeling like you pee and then there's a little bit more dripping out and then maybe it dribbles out after you leave the bathroom. We call that a post-void dribble, which is basically a type of leaking. It would be leaking overtly.
And this could happen to anybody. This is not, now I'm imagining like a age dependence kind of issue. This is like normal, even for a young fit person.
Yes, absolutely. Okay. Because when the pelvic floor muscles get too tight, they are also effectively weak. I mean, when you think about true strength, it's the full range of motion of the muscle. So if they're just sort of halfway gripping between contracted and relaxed.
For people who are listening, Alex is doing like a little T-Rex arm situation here.
It's so ineffective. Yes. You can't fully empty, you can't really close it off. So you cough and it comes out. And so it's really not just muscle atrophy. It can be when the muscles have tension too. So yes, urinary urgency and frequency, hemorrhoids and straining on the toilet for bowel movements is a big one that's pelvic floor. People don't realize that. Tailbone pain, tip of the penis pain. The pelvic floor refers to throughout the penis and testicles and up into the abdomen. So they could be having pain in their lower belly and just not really being able to figure out where that's coming from. And it's coming from their pelvic floor. Definitely the whole range of bowel issues. So fecal incontinence, bowel urgency, constipation and straining, hemorrhoids, like I mentioned, and then all of the sexual function issues. So pain with orgasm, not being able to orgasm, orgasming too quickly, premature ejaculation, erectile function issues where they're losing their erection, they're not able to get it, they can't get it consistently.
Mhm.
And those issues are so, I think, deeply entwined with a person's
Mhm.
self-esteem and
Mhm.
self.
Mhm.
And so suddenly this impacts their relationships, it impacts how they feel about themselves, it impacts their confidence,
Mhm.
and they feel so isolated and alone, like they're the only ones. Of course, Viagra is very common.
Mhm.
So people will get that medication frequently for some of these issues. But when it's a muscular dysfunction, that really only goes so far with blood flow,
Yes.
which is one piece of the puzzle. And obviously, I think our very first episode was erectile
I
function,
think
right?
that's right. Yeah.
Yeah. And so that is one of those things that people don't realize. It's actually a cascade of events. It's not just the blood flow that causes that to happen. The
Mhm.
pelvic floor muscles maintain it.
Yeah, that's right.
Yeah.
It's a hydraulic event.
Correct.
You have to get the blood flow into the penis, and then the pelvic floor muscles have to maintain
Yeah.
that by
Totally.
contracting.
And then unfortunately, if you're just gripping the whole time, that frankly makes everything worse.
Yes.
And so it's not as simple as saying, just the muscles tighten and everything stays. No, it's just about the coordination, the endurance, the ability to lengthen and relax and actually let go. And a lot of times it's releasing some of that gripping behavior.
Mhm. And I think that what I know about those sorts of issues, urinary, fecal incontinence, all the sexual function, there's going to be anxiety
Oh,
there, and there's
makes it so much worse.
so much worse. So that probably is happening for folks,
Yes.
which may then also prevent them from really getting a full evaluation of what's going on, because it could be that it's just a blood flow issue. It could be that constipation truly is actually just diet,
Yeah,
right?
yeah.
Like they might need to eat more
Mhm.
fiber and drink more water, and that's going to solve the problem. That could be the case, but what I understand, and correct me if I'm wrong, but what I understand about pelvic floor function is that it's so global
Yes.
that if you are over time, like, so if you're
Straining
having
over time. Yeah.
straining
You
over
develop
time,
it.
then you develop it. And so
100%.
then there is an issue where there might not have been one before that you could do something about.
Chronic stress, sitting at your desk all day, hunched over,
Mhm.
your posture, all of those things contribute to changes in your pelvic floor muscles. And so you're right. It's the chicken and the egg kind of thing. But then at the end of the day, I do think coming into a pelvic floor physical therapy practice where we have also the trauma informed aspect of the care and the psychosocial aspect of the care, where we really are delving into
Mhm.
the lifestyle, behavioral modifications, all the tools in the toolbox include openly talking about that fear and anxiety that's
Mhm.
playing a role and the stress that's playing a role. And then we're doing so much of the 360-degree diaphragmatic breathing, getting the vagus nerve to help us with the
Mhm.
healing, which helps us get out of that fight or flight. That I think then, of course, I'm biased because I love pelvic floor PT, but then we're actually addressing some of those things and we work
Yes.
closely with you.
Right. But I do think that you address a lot of those things. I mean, I do get referrals from you. I do get referrals from other pelvic floor
Yeah.
PTs, but a lot of working with anxiety is understanding
Understanding
anxiety
it.
and being able to have a place that you can talk about it.
Totally.
And then also, when the anxiety is around a particular function or lack of function, feeling a little bit of mastery around that
Yeah.
is, really incredibly helpful.
Totally. And just understanding the context in which something is happening so that you can share it with your partner in the event that this is impacting the intimacy with someone else.
Right.
And I think that can be so freeing. And I have had patients where I've said, listen, I know this is probably uncomfortable for you. And this is going to be our next episode, which I'm so excited about, is I know this is going to be uncomfortable. I want you to actually have an open discussion.
Mhm.
And I want you to say, it's possible that I will lose my erection.
Mhm.
I still would love to try with you. If that happens, here's my plan. I'm going to focus on you.
Mhm.
I'm going to focus on bringing you pleasure, all that. And it's amazing when someone's brave enough to say that. The partner also wants them to feel good,
Yeah.
So they're so relieved
Yeah.
that they can actually talk about it.
Mhm. Yeah, I mean, I think that from a sex therapy perspective, one of the biggest issues that I see with erectile dysfunction when it shows up in a partnered situation is that the partner who has lost the erection is often completely withdrawing.
Yeah.
It's not discussed. It's not talked about at all. There's so much shame there.
And there's so much self-focus.
Exactly. And so then the sexual encounter is like over and it's confusing for the partner. They're left with these questions about, do you not find me attractive? Which is not the issue.
No. And also then it makes, everybody feels hurt.
Everybody feels hurt. Everybody feels insecure. Everybody feels shame. And it puts all of those things, take a person out of intimacy, out of connection.
Right.
And so then not only have you lost the sexual encounter, you've lost the connection with your partner. And then it's awkward and you can't talk about it. We're going to talk about talking about sex.
Yeah.
We'll talk about that more. But I think that you do a beautiful job of this as well, because like with this discovery call that you had, and I'm sure that you say this to patients all the time, you talk about this stuff all the time, so openly. You ask these questions so matter-of-factly. And that is so de-shaming. It's just like,
It's like, oh, okay, I'm not the only one.
Yeah.
Like, this is actually so common that she's talked about it every day for 16 years. What a weirdo. But it's like, just so it puts people at ease immediately.
Yeah.
Because then it's like, okay, I'm in the right place. I just see people's shoulders drop. Like, I'm safe. I'm in the right place. Maybe there's hope for me. Which is so cool. And the first step is knowing you have a pelvic floor and what it does. So I'll say that next, because for men, this may be the first time that they're hearing about these muscles, which are so critically important to so many vital functions in their life. So the pelvic floor muscles run from the pubic bone to the tailbone inside your pelvis.
I wish we had your little,
I know. I know my model.
Yeah.
So we can maybe get a picture of it and show people. So the muscles run along the base of the penis up to the pubic bone in the front, and then they wrap out to the hips, and then they go all the way to the sacrum and the tailbone, which is the end, the coccyx, which is the end of the spine. And these muscles are almost like a trampoline or a floor at the base of your body. And so the diaphragm, which is your breathing muscle, is at the top of the trunk, and the pelvic floor is at the bottom of the trunk. And so it's really great to be able to visualize where they are, so that you can know kind of how to feel the muscles in your body. They stop and start the flow of pee. They stop and start the passage of gas and bowel movement. They help maintain an erection. They help with orgasm. And they're just critically important to supporting your organs. And so the urethra, which is the tube that you pee through, goes from your bladder, passes through your prostate, and then through your pelvic floor muscles, and then down through your penis and out. So it's really important for people who have prostate cancer and who get their prostate removed to understand their pelvic floor muscles, because once it's almost like you have two aspects to the faucet, and then once the prostate is gone, the aspect that's left is your pelvic floor. So you need it more than ever. And so that is where I truly wish that we could improve our access and referral, is for people that know they're going to undergo prostate.
Oh yeah, we
surgery.
talked about this in one of our
and then people who have
so
already.
Huge.
And so I do feel that is a little bit of a miss, or that's an area of improvement in our healthcare system, that we could really help these people with their knowledge base ahead of time, so that they feel more confident going into their recovery, but also so that they can recover better.
Yeah. What about for folks who have a large prostate, which happens to many folks as they age? It causes a lot of urinary urgency,
retention,
frequency. So what is there anything you can do about that?
Yes, in the sense that once you are, let's say you get on Flomax or whatever, basically what happens is the prostate is doing the pelvic floor's job for it for a while, so instead of the pelvic floor needing to kind of maintain that, the prostate's kind of doing that. And so then when you resolve the issue, suddenly your pelvic floor is weak, and it can actually kind of have that downstream effect where you're like, oh my God, now I've fixed the prostate hypertrophy, and now I'm leaking, or now, I'm dealing with sexual function issues, because the pelvic floor kind of got to be lazy for a while. And so it has to kind of kick back in.
Kicking back in. How often should people be getting up to pee at night? I mean, should is,
Before 65, 0 to 1 times, and then after 65, 1 to 2 times is the stats that are from 15 years ago when I took the first pelvic health course. It would be interesting now that HRT is back on the table. I know we're talking about men today, but I'd be curious if the nocturia, which is nighttime voiding, if those numbers shift as people start to get better access to care. But 0 to 1.
Okay. And what if, one of the things that I just sort of anecdotally and with people in my life and have heard is that getting up to pee at night, a lot of people are getting up to pee a lot more than that.
Yeah. And so,
Even when they're young, even
yeah.
if they don't have a prostate issue, even if so,
Yeah.
I
Let me
mean,
talk about that.
obviously drinking.
Yeah.
Yeah, tell
So
me about
it's
this.
multifactorial. Some of it's behavioral. You wake up at night, you can feel that your bladder is getting pretty full. So you just get up to pee just to almost help you get back to sleep.
Yeah, it's
So
like
that,
you're anxious that you have to pee, so then you can't get back to sleep. So
yeah,
you
just like a
better just
habit.
do it. Yeah, okay.
But the bladder is one of the most habitual organs in the body. We potty train as kids. We're very susceptible to habits in the bladder.
Mhm.
We call them jick pee, just in case peeing. And so the jick pee is like peeing before you leave the house, peeing before you go into the movies, peeing before you leave the restaurant, whatever. And you don't actually have to pee. Your bladder's not truly full, but you're telling it that it's time to go. So over time, your bladder then tells you that it's time to go before it's
Mhm.
actually full. And your bladder is like a balloon. It will expand or shrink depending on how much you allow it to fill. So then your bladder shrinks and can't even hold that much anymore. So yeah, then you have this urgency and frequency problem. And so you're right. Part of it is we forget to drink water during the day, and then we're trying to like backload the water.
Mhm.
Part of it is chugging fluids. Once we start chugging, if we right before bed we drink a full water bottle, our bladder will spasm because it doesn't know how much more is going to come.
Mm.
Part of it is that our kidneys, as we're resting, do a lot of the filtration. So any of the fluid that kind of pooled in our lower extremities comes back up through the lymph system into our cisterna chyli in the midsection, and then it comes out through our pee.
Mhm.
So if you are a person that kind of swells or has some fluid, then you lay down, gravity pulls it all back up, and you pee it out. So it's very multifactorial, but I think typically if people are dealing with nighttime voiding as a problem, we do try and sip fluids consistently throughout the day and then stop around dinner time so that it's not
Mhm.
lingering. We do have them put their legs up, kind of drain it a couple of hours before bedtime so they pee it all out beforehand. And then we do try and have them ignore the urge when they wake up and see if they can go back to sleep. The interesting thing about that is during the day, distraction is a really helpful tool for urge suppression. And at night, there's nothing to distract you.
Mm.
So it's harder at night to do that.
Mhm.
But because the bladder is so habitual, if you just get up and go at 2 a.m. every night, then your bladder is going to start waking you up to go at 2 a.m. So you have to break that habit by telling the bladder, no, it's not time to go. So even if you're only able to wait 5 minutes or 10 minutes, you're still taking back control. I'm in control of my bladder. My bladder is not in control of me,
Mhm.
and that's the mantra. So you're in charge.
Mm.
And so, let's say you just can't fall back asleep. At least you delayed it for a little bit.
So when you see this, and the reason why I'm asking so much about this is because I think that even when men do not have an enlarged prostate, they
Yeah.
might go to their doctor. This is something that I think
Yeah.
happens a
Yeah.
lot.
Mhm.
They have this nighttime peeing situation. Is this a pelvic floor issue? Is this something that would be tightness in the pelvic floor, or is it more habitual? That's what I'm sort of hearing,
I
is that
see.
it might be habit.
It absolutely can be from an excess tension in the pelvic floor, which is pressing on the bladder, making you feel like you have to pee all the time. And
But
it
that wouldn't only be at night.
no, it would be in
All
the
the
day
time.
too.
I
Yeah.
see.
And also, I think the pelvic floor dysfunction would lead to nighttime voiding in the sense that you're not emptying completely before bed.
Mhm.
But a lot of the bladder stuff like this is habits.
Mhm. Mhm. It's almost like you have to when you sleep train your kid
Yeah.
and you're like, "It's terrible,"
Yeah, it's
and you
terrible.
might
Totally. Yeah.
sacrifice
Yeah.
a
Yeah.
little
Yeah.
sleep.
Totally.
You have to
It's
sleep
terrible.
train your
Yeah.
bag
Yeah, you do.
your bladder, and it's
Totally.
gonna throw a little fit.
Exactly. And
Yeah.
sometimes starting with healthier habits during the day is just an easier place to start, because if you're already having urgency and frequency during the day, fixing that during the day kind of gradually helps you get a little bit better about it at night
Mhm.
too.
Mhm. Okay, what else? Did we
Oh
miss
my gosh.
anything? What else?
Well, first of all, that men have a pelvic floor. I
Yeah,
think that
number
it's
1.
critically important for bowel, bladder, and sexual function, but it also plays an integral role in your core, in your abdominal muscles, in your breathing.
Mhm.
And so these athletes actually repeatedly tell us how much their performance improved
Mm.
because suddenly they're weightlifting better because they have better breathing mechanics. And so I do think that it's really wonderful for people who are aging, sedentary, go through prostate cancer and prostate enlargement, that it's also equally as wonderful for younger people as well, and especially cyclists. It used to be called cyclist syndrome, pudendal neuralgia, because the bike seat just does so much damage. But now we call it pudendal neuralgia. But yeah, the original term was cyclist syndrome. So I think that's really interesting. That was what the New York Times article was mostly.
Yeah, mostly about.
Yeah.
So people often think of you go to a PT because you have, I don't know, had a knee replacement or you have an injury. But what I'm really hearing, particularly with the pelvic floor, of course, that's incredibly helpful.
Yeah.
If there's an injury, if there's an issue, if there's a cancer or something like that. But also, if you wanted to increase your performance as an athlete, if you want to, this is so interconnected.
Yes, it is.
That it also can be like an optimization kind of situation as well.
Definitely. That's not how our Western healthcare system works, but
it's not.
I'd love for it to work that way.
Yeah, I mean, wouldn't it be lovely? And especially as I've heard you mention a number of times, Massachusetts being a direct access.
Yeah, you don't need a referral.
You
need
a referral. You can just come in. Yeah.
Cool.
Okay.
Thanks,
Alex. Thanks for listening to Under the Hood. We hope you enjoyed this episode.
Please like, share, and subscribe.